Michelle Christine, daughter, sister, mother, friend, community volunteer, Black female health professional, here to share information with my community to help empower us to live and be our best selves. Let's decide together how to live a life filled with making healthy choices for our mind, body, and spirit. We can and we will change our own health outcomes. Here we go. Let's get into Black Facts. Welcome to Black Facts. I'm your host, Michelle Christine, and this week we'll be talking about health equity with our special guest, Ms. Rhonda Smith, Executive Director of California Black Health Network. She previously served as the Executive Director of the Life Serve Youth Foundation and as the Interim Executive Director for Integrative Medicine for the Underserved. Welcome, Ms. Smith. So happy to have you here on Black Facts. So I'd like to welcome you all to Black Facts. Today's guest is Ms. Rhonda Smith. She is the Executive Director of California Black Health Network. Hi, Ms. Smith, how are you?
I'm doing fine, Michelle. How are you?
Good, good. So can you please tell our viewers of Black Facts, what is California Black Health Network?
So the California Black Health Network is the only Black-led statewide organization here in California that advocates on behalf of African Americans and Black immigrants to achieve health equity.
Okay, thank you. Can you explain to us, so you said that Black Health Network advocates for health equity. What is health equity? Like, can you explain to us in simple terms, what is health equity?
Right. So health equity is when there is fair and just opportunities for all of us to, no matter where we live, what we look like, how much money we make, who we know, have access to have the opportunity to live a healthy life. So it shouldn't matter like what type of health insurance you have or like what color your skin is. When we go see a healthcare professional and seek out healthcare, we should all be treated the same based on our needs and not necessarily based on some preconceived notion about who we are, where we live, or what we may do, or how well educated we are. Because we see that, when it comes to racial bias within the healthcare system, it doesn't matter what your education level is or your income level. Unfortunately, the disparities are the same, right? What we see across the board.
So you told us what Black health equity is. Why is this important to our community and why should we care?
Yeah, because unfortunately, when it comes to all diseases, whether it's chronic diseases or cancer, Black folks unfortunately die at a disproportionate rate compared to the benchmark is typically the Caucasian population, but unfortunately we are at the top of every list from birth to death. So when it comes to maternal health and infant mortality, and even to what happens when it comes to end of life, whether it's palliative care or hospice care, those conversations and what we have access to in terms of treatment or resources, it's very different. And so unfortunately here in California, if we look at an aggregate number, the life expectancy of Black Californians is it's the least and the shortest compared to all racial and ethnic groups. Then when we talk about Black men, when you get to a more granular level for Black men, it's even worse. And unfortunately, even though overall life expectancy has improved, when we look at what has decreased, relatively speaking, since World War II, that has not gotten any better for Black men in particular.
Wow. So now we understand why it's important. Now, can you explain to us how we can go about advocating for our own health equity?
Yeah, so it's, now is the time, right, for us to speak our voice. And
yes.
How we look at health equity at the California Black Health Network is it sits at the intersection of racial justice, social justice, and environmental justice. And so, we've all been glued to the TV over the past few months or year now, what's happened kind of in all those areas, definitely when it comes to racial and social justice. And so just speaking up when we see things are things that are wrong being done to people that we know and care about. And even sometimes when we go to an appointment with our family member and we see how that provider may be treating or talking to or not listening to our loved one, you can speak up. You have the right to ask questions. You have the right to, know what your options are and what resources out there available to you, especially if we're talking about serious illness like cancer. And if we're talking about a stage 4 cancer, often I see women and hear women, because I'm a breast cancer survivor, so I know a lot of survivors. And sometimes when we're a stage 4 Black woman, it says, I'm sorry, there's nothing else I can do. There's no treatment for you. But I see a lot of women who are metastatic breast cancer survivors, who are white women who live 10, 15 years, but I very rarely see an African-American or Black woman in the same situation. And so I think if we're well informed and are more health literate, then we know that, hey, if that doctor's saying that, like, what about a clinical trial? Know how we feel about that as a Black population, but it is an option and could be a life-saving option for some women. But oftentimes, unfortunately, we're not offered, or we don't have those conversations. And the doctor who's taking care of us, unfortunately, often does not engage in or initiate those conversations about other options.
So
or fight in the way that they.
So you're saying the simple things that we can do to advocate for ourselves is to speak up and to voice our opinions, and to make sure that we look for other options, as far as making sure our vote counts, right. Participating Definitely. In clinical trials, doing things that we need to do to ensure that we're getting the right care and treatment that we deserve.
Yeah, and I think being well informed and knowing that, we have the right to ask questions and challenge. And so really being able to advocate for yourself and knowing how to navigate through the system of care is also important. Right.
Also, I'd like to ask you, so should we get involved in things like policy change?
Sure. Policy change and advocacy work goes hand in hand. And sometimes we don't always get what we want, but it's still important to speak up and, make certain people who are in positions of power and, have the opportunity to make decisions on our behalf who don't really understand what the issues are. It's important to be in front of them and advocate on behalf of, populations of people who don't have a voice for themselves or to represent them, and to help, tell the story, help provide better understanding of what the needs really are, especially within our communities. There's a lot of times we see it every day, right? There's such a big disconnect between what people really need and what the politicians' agenda and motivations are. Right. Even though they're elected to represent the people, in reality, it doesn't always work out that way.
Exactly.
A lot of times when we talk about policy, it's really more, it should be about people, but it's really more about power and politics, and sometimes profit, So it's a game that you have to navigate and really understand how to play and navigate through that system as well. But, relationships are important, and really having good connections to policymakers and their staff and their office is advantageous when it comes to really making policy changes.
So let's talk a little bit about that. So advocacy seems pretty easy. I think we can all do that.
Yeah.
Policy change. I know oftentimes, even myself, I get a little bit resentful because I feel like, it just takes too long. It takes too long for any policy to come in, into act. So what can we do? Like you said, I heard you say talking to our local politicians or council members. What other things can we kind of do to help move policy change along?
Well, so I'm a strong believer in collaboration and working with other organizations that, sometimes may have a bigger voice than you, although we're maybe working towards the same goal. Sometimes they are in a different or more advantageous positions. So I think leveraging relationships and those connections and partnerships and collaborating around common issues and bringing people together collectively can also be very powerful and influential. So I think bringing the right people to the table or to the party, right, can also be very helpful.
I love it. So basically you're talking about being civically engaged. We all need to do our part to be civically engaged and to make sure that, you know, we're getting the healthcare and the treatment that we need and so deserve, right?
And
everybody has a right to healthcare.
Right, and the resources in our community, because unfortunately there are communities across the state and across the country where, you know, we reside that are medical deserts as well as food deserts, right? In terms of, you know, so there's no healthcare center or a well-established healthcare facility in our community. So that influences access to care and what people are able to do to take care of themselves and seek, you know, preventative care and sometimes primary care.
Okay. So let's talk a little bit about what is the Black Health Agenda?
Yeah, so the Black Health Agenda is it's a set of priorities that are important to focus on here for Black Californians. And so the California Black Health Network developed the first Black Health Agenda, and it was published in 2019. And now with COVID, you know, things are very different now. So we are in the process of developing a new Black Health Agenda in the age of COVID. Although some of the priorities in terms of health disparities and the degree of those health disparities here in California, you know, hasn't really changed. For example, maternal health was definitely a top priority from the 2019 Black Health Agenda and will continue to be. You know, when we see what's happening with Black women, and then Black babies, because there was a study that was published and on CNN.com a few months back, well, actually sometime last year, that talked about the fact that when Black babies and Black mothers are taken care of by a white provider, especially in birth, Black babies are 3 times more likely to die.
Yes.
Yeah, I mean, and that's horrific, right?
Absolutely.
And there's no reason for that. But, you know, like I said, it doesn't matter how much money you make because we know what happened in Serena Williams' case. And in that case, you know, she advocated for herself and demanded that she get what she felt she needed.
And she saved her own life because of it.
I was going to say, if she hadn't done that, right, she may not be here today to tell the story. So, you know, it's unfortunate, but that is, for me, what I say, the big elephant in the room that nobody in the past had been wanting to talk about, that is the real crux of the reason why we have health disparities. You know, it's what happens at the system level and the bias that exists there that really has a significant impact on the health outcomes of people of color.
You talked about reshaping the Black Health Agenda in light of COVID. So how can we, as, you know, Black community members in Southern California, how can we get involved in that?
Yeah, so there's an initiative, a statewide initiative called Vaccinate All 58, which is, you know, the idea is to get all 58 counties across California vaccinated. And so, you know, there have been challenges in the distribution of the vaccine across the country and in all states. So I think the first thing to do is to go to the California Public Health Department to get information on the facts about the vaccines. You know, what is the truth and the facts versus the myths that have been circulating in the community, first of all. And then also for those of us who are the frontline workers or, you know, older people, you know how you can get the vaccine because those are the priority groups. And then where to go to get the vaccine and when is your turn to get the vaccine. So all that information is available on the California Department of Public Health's website. Okay. And part of the Vaccinate All 58 information and materials too.
Okay. So Rhonda, tell us, in your opinion, what is the greatest barriers to health equity for our community?
Ooh, how much time do you have? So let me start by saying I believe that, health really happens outside the four walls of the clinic or any healthcare facility. And so it really is dependent upon, what our life is like on a daily basis. And so if we're subjected to a lot of stress, right? If we don't have access to healthy food, that influences our health. If we don't live in places where there are safe spaces to play or any spaces to walk or play or be physically active, I mean, those are all barriers. And those are called, so they're related to social determinants of health. So unfortunately, someone's zip code really dictates and determines how well people live and how long they live. And it shouldn't be that way. So until we start to address the social determinants of health, and some people say the political determinants of health, then and what happens at the system level when we're seeking care, I don't believe that we'll, see the kind of change we need to see, across the board with a reduction in health disparities and an improvement in health equity overall.
So are you saying there's really kind of right now it's a structural or systematic issue? So there's nothing we can do as individuals or as collectively as a community to try to decrease some of these barriers?
Yeah, so I look at it, so there's three levels, right? There's the individual, the community, and the system level. And of that, the things that we can most likely change or have the power to change is what we do as individuals, right? And then we can advocate on behalf of getting more resources or changes in our community. But if we, as individuals, start by being more empowered to take charge of our own well-being and understanding what it takes to do that, because most chronic diseases, as you well know, stem from nutrition, physical activity, and lifestyle. So those are things that we have the power and control over, and we can make choices about. Now, unfortunately,
say that one more time. So we have the power, right? We have the power to take control of our own health narrative.
Yes, that is
and
true.
do things differently as individuals.
Right. We all have the power of choice. Right?
Yes.
And the power of knowledge. If we are, well informed and seek the knowledge that we need to have better health, then yes, we can understand how to make better choices. And even in situations where, people do live in food deserts and may not have consistent access to fresh produce, there are other ways, right? There are grocery stores. So even frozen is better than canned.
Right.
So, try to stay away from anything in a bag, box, jar, or a can for sure. So because there's all processed foods. And unfortunately, there's a lot of fast food restaurants and a lot of convenience stores that sell packaged goods and processed foods. And so if we are able to try to shy away from that, it will help us live a better and longer health and healthier life.
Thank you. You said so many poignant things. So I want to ask you, in your first 90 days as executive director for California Black Health Network, what do you hope to achieve?
Yeah. So in my first 90 days going forward. So one of the things I have to say that I had the benefit of acting as the interim executive director for about 6 months before taking on this role. And so I had that foundation and groundwork and knowledge and understanding of the organization and being able to navigate through what was happening with COVID and the time of the Black Lives Matter movement and racism as a public health crisis coming to the forefront. So to me, that created the perfect storm, like between COVID, racism as a public health crisis, Black Lives Matter, and even here in California, especially, the environmental effects of all the fires that we had last summer and consistently have every year and often. And so even though we may not be able to see the smoke, right? So there are things that we can't see, taste, touch, or smell that are still harmful in the environment that can affect our health and well-being too. So those are things that definitely I think have gone unnoticed, untalked about, and unaddressed in the Black community that we feel is important too as part of our overall health and wellness, and definitely a focus on health equity. And so taking all that into account, I see it as an opportunity to really strategically pivot the organization. So going forward, we'll still do community convenings, which has been a long part of the history of what the California Black Health Network has done. But we will focus more on collaboration. We'll focus more on community engagement and capacity building, both inside the organization and out and with the work that we do through our collaborative partners. We launched the campaign for Black Health Equity back on Giving Tuesday in December. So it was a soft launch, and we hope to make a bigger splash as we move forward through the next year and definitely the next 2 years. So, our goal is to really grow and expand the organization, yes, but also to improve the health literacy of African Americans and Black immigrants across the state, so that they can make, better decisions and better choices and understand how to. We also hope to, when it's all said and done 3 years from now, really have an impact on that aggregate number that I mentioned earlier, the life expectancy of Black Californians. So we'd like to see some improvement and shrinking of that gap. And, as a result of the work that we do and being more, doing more work at the community level and working with and through community-based organizations and partners to make that happen.
Okay.
So, it's power in numbers, and like I said, we're all working towards the same goal. So each organization has its own core competency. So coming together for the common goal and the common good, and doing that in a collaborative and a way, I think, is going to be the way of the future. At least that's the way we're planning on operating, because we can't do it all alone, but we can do it together and have a greater impact.
Absolutely. Can you talk about some of your other collaborating partners that you're working with?
Yeah, so we I have a very good relationship and partnership with the California Black Women's Health Project. Mm-hmm. So from a community-based organization standpoint, that's one. We are also in the process of developing a partnership with the California Primary Care Association, because they have over 1,300 members that are community healthcare centers, and through that are able to see their providers, and all of those are able to see about 444,000 Black patients across the state. So by going through that one partner, we get access to a lot of people across the state in terms of being able to disseminate information to, helping providers understand how to communicate in a culturally appropriate way with their patients. Mm-hmm. And so we're partnering with organizations at the system level and the community level to do that. And even we will, going forward, I say everywhere where we eat, play, shop, pray, and, do all of that. So whether it's in the faith-based community, through barbershops, hair salons, all of that, we have to meet people where they are, and do the work with and through partners in the community to make all that happen.
So I am just one individual, and I am so inspired by learning more about California Black Health Network, and I want to get involved. I want to do something to empower my people, my community, to improve our health equity. So what can I do? How can I get in contact with you?
So you can join the campaign for Black Health Equity by either calling the office at 916-333-0613, or you can go to the website. It's is California abbreviated, blackhealthnetwork.org, and you can join the campaign on the website. So there's plenty of visuals for you to find your way and navigate through the website. And actually, we just launched the new website about 3 weeks ago, I think, beginning of the year. Yes. So it's new and fresh. Yeah.
Okay. And so anybody that's any Black person in the Black community in California can get involved?
Yes. Okay. So just contact the office. You can email info@californiablackhealthnetwork.org to contact the office via email. So anyone, Black, white, brown, purple, who wants to be part of this movement and support the work that we're doing, we welcome. We're an inclusive organization, even though our focus is on the Black community. But, we partner with all sorts of organizations to do our work.
Great. Okay. So any other parting words to our viewers that you'd like to share?
Other than Happy New Year to everybody, first of all. But yeah, I think, I guess my biggest ask is right now, especially because, COVID has done a couple things. It's kind of a double-edged sword. It has shed a light on the fact that, there have been health disparities in the Black community for such a long time, although a lot of people were not aware of that. So COVID has brought that to the forefront. But on the other side of that, it has also exacerbated, the disparities that exist. Unfortunately, Black folks are 2 times more likely to get COVID and about 3 times more likely to die from it. So, I expect that life expectancy number that I talked about might be even worse come the end of, when the release of the end of 2020 data comes out. We hope not, but just based on what we've seen so far in the disparities, that's a likely outcome. And so for now, I say mask up, always, don't touch your face, stay 6 feet apart. And just because the vaccine is available, you should not stop practicing those habits.
Yes.
That's something that's important to continue to do to protect yourself and your loved ones still. So the vaccine can help, yes, but we still need to be mindful about the other non-pharmaceutical actions that we can take to stay safe and keep others safe as well.
Thank you so much. It has been such a pleasure having you on Black Facts. I really appreciate it. You have shared some important facts with us today about what Black health equity is, how we need to get involved, and how we can do, what things that we can do on our individual basis as far as advocating for ourselves and just being civically engaged and making sure that, we're a part of the solution, right? We're a part of change, and we can do things on an individual level as far as taking care of ourselves better, eating better, being physically active. So I just really appreciate you sharing those words of wisdom and telling us how we can get involved to not only improve our own health outcomes, but to make sure that we're working together collectively as a community to improve all of our health outcomes. So thank you again. Ms. Smith, I really appreciate it. And I'm going to have you back because there's some other things I'd like to talk to you about and share with the community. So thank you so much. I really appreciate you taking the time to be on Black Facts.
Well, thank you for the opportunity. I look forward to connecting with you again.
We've learned so much today. We now know what health equity means and why it's important to the Black community. We also know that we need to advocate for policy change. Will you join me? Let's be the change our community needs. Thank you, Ms. Smith, for being here with us today, and I wish you success as you lead our California Black Health Network to the next level. Thank you for tuning in to Black Facts. Together we can and we will improve our own health outcomes and that of our community for future generations. If you have questions or suggestions for show topics for Black Facts, be sure to email blackphacts@gmail.com. Also be sure to follow us and subscribe. Join me the next time for another engaging conversation and know the facts.
Black Facts, talking about Black Facts. Black Facts, talking about Black Facts. If there's a problem, we can solve.